back to the Clubhouse 54 podcast. I'm Michael Little, Drew Lockhart, and we have a special guest here with us tonight. He is the owner of Core 3 Physical Therapy, Dr. Caleb Slater. Doctor, welcome to our show.
Yeah, thanks for having me. I'm excited.
Welcome, Caleb. I won't call you doctor. I'm just going to call you Caleb.
That's perfect.
I'm going to call him doctor. You got to show him some respect.
Unless he's doing something to me. He ain't a doctor to me right now. So, Caleb, welcome to the podcast.
So how many locations do you have with Core 3 Physical Therapy?
We have 4 now, so we just opened our 4th.
Nice. Okay, so Hatfield, Norristown.
Yeah, Hatfield, East Norton, Chalfont, and Limerick's the newest one.
Oh, wow. Okay, Limerick now.
Yeah.
Wow, okay.
We're trying to do a Willow Grove one, and then maybe a Skipback one too. So we're working on it.
Awesome.
Yeah.
I love it. How many employees do you have?
Somewhere around 30, somewhere around there, 30, 35.
Now, who manages all that?
Sam.
Okay.
Yeah. So we have a business manager, Sam, and it's all her fault, what goes on and stuff like that. So
Of course.
I just do podcasts now,
Okay. Drew, he stopped working.
I know. He just is like, hey, I'm podcast only. I wish I could be that way.
Not to spoil his thunder, but he wrote a book, and now he's just doing podcasts and enjoying life.
No, now because of the book, now I'm back to work again.
There you go. Love that. So, if you don't mind, I guess for our listeners first. So Caleb is actually a relative of mine. Danielle's my second cousin. I believe she's my second cousin. So we are related. And I met Caleb when I had an injury. I actually fell out of a tree, Drew.
He was trying to get his kite back.
So
All right. So there's 2 instances in my life that I've known him where he's fallen. Okay. The first one was down a flight of steps. But falling out of a tree may trump that. So go ahead, tell the story, please.
you want to hear the story? It's very simple. It's very basic. So it was an ice storm in January, and my wife said to me,
when you're normally up a tree.
Who climbs a tree when there's ice on it?
No. So my wife says to me, she goes, I want the Christmas lights down. It's January. She said, the Christmas lights have to come down today. And I go, well, the tree's slippery. I said, we just had an ice storm. This probably isn't the best idea. So I'm up in the tree. And as I'm going I get the lights down, by the way. Okay. That was the impressive part. And I'm going to jump out of the tree. And as I go to jump out, I slip. And I fall head first. So I'm not breaking my neck.
Okay.
So what braces my fall? My left arm. My shoulder pops out of place. And luckily, my neighbor was outside, and he's an ex-police chief. Well, he was. I moved since. But he was an ex-police chief, and he was able to pop my shoulder back into place.
No way.
Yep. So he pops
Right
it back
there
into
on the
place
lawn.
right there on the lawn, and I get in the car, and I drive to the hospital. And fortunately, everything was okay, other than the fact that I needed some physical therapy, and Caleb ended up coming to the rescue and helped me out. But I was down for... I want to say it was 3 months. Couldn't swing a golf club.
So what was the injury besides obviously putting your hand down? Where was the injury on you, and what did he do to
Caleb?
Well, so he kept reoccurring dislocating his shoulder, and for little stuff too. I think one time you're playing with the kid, went to go reach your arm out, and it just, dislocated. And so thinking back on it though, we were talking, that was 5 years ago, something like that?
That was 2016, because after you helped me out, I won Player of the Year in Philadelphia.
Look at that. Yeah.
Best injury I ever got.
And, so we treated you. We did some neck exercises, right? But then we did a lot of stability exercises for your shoulder. But since then, we've really focused more on the spine, and we can get into the rationale for it. And if I were to treat you today, I would have done almost all spine neck exercises. I would have done very little shoulder, because often it's not the shoulder instability, it's the nerve getting to the shoulder muscles that's causing that instability. And that's what we found, and that's what our treatment has really turned into. And since we took that kind of next step of focusing on that, our treatments have been so much better. And not only that, we've been able to treat like just some weird shit that you wouldn't go to physical therapy for. Like one of the big ones is Crohn's, and that's what I'm getting blown up a lot right now on TikTok about people talking about Crohn's and that I'm treating it. So we're getting people that are coming in or flying from different states to be treated for Crohn's.
Wow.
Because there's nothing else out there other than medication, and the medical system right now just labels it as an inflammatory condition, and that's all they have for it. That's the only label, that's the only box they have to put you in, and I'm like, we found that there's another explanation.
So right now, if you have Crohn's disease, what do you have to take a pill that could potentially lead to other?
Well, most time they'll try a bunch of like prednisone, so I have this patient right now that she's on 30 milligrams of prednisone a day, and they'll do that for a certain amount of time, but you can only do that for so long before the side effects of prednisone, kick in, weight gain, Cushing, some other stuff, right? So then they'll go to stronger medications, which are typically infusions or self-injections. So they'll do like Remicade infusions or Stelara infusions. So you have to go get an infusion like every 4 weeks, 8 weeks, something like that. Or you have to do Humira injections, where those are self-injections. So you have to figure out how to inject yourself every other week, every week. Wow. And you're just on these strong, lifelong medications, again, for the rest of your life.
So you're getting people off of those medications?
Yeah, we've had a few people. This is still relatively new. Yeah, within the last like 2 years. The first patient that I had was kind of an accident. Again, we've had this like spine-centric approach to a lot of our patients. If you come in for shoulder, elbow, wrist, hip, knee, foot, and ankle pain, we know we're gonna listen to your symptoms. We're gonna map out your range of motion and stuff and your strength, but then we're going to look at your spine to see if we can fix it by treating your spine, if there's an actual problem at your spine that was causing it.
Wow.
But we never took that next step to some internal conditions. And so I had this friend that she came in and she said, is there anything you can do? She's kind of at the end of her rope. She's hospitalizations, and she's been on Humira once a week for 5 years after 3 hospitalizations after her cortisone, prednisone wore off. And so I said, all right, let me take a look. And I evaluated her spine, and the areas of her spine that were limited in motion or painful, those are the areas that correlated to her intestines. So we've kind of mapped out in your body. We know your C3, C4, C5 goes to your shoulder. We know your C5, C6 goes to the outside of your elbow. Your T2 goes to your inside of your elbow. We know where the nerves emerge from your spine and where they go in your body. We know that as a medical profession. So the areas that correlated to her intestines and her stomach, those were the areas that were problematic. So we worked those out, and within 5 weeks, she felt basically 100% better. So she stopped taking her Humira, and she's been off it ever since. And that was close to 2 years ago.
Wow.
I tell you what, I've had a couple back injuries, lower back, just minor things, not anything, I'd go see a chiropractor once or twice, feel better, and stop. But I'll tell you what, prednisone, you give me a Z-Pack, or no, it's not a Z-Pack, or steroid pack. Yeah. I tell you what, I feel like the Hulk.
Oh, it's magic, right?
Like, especially if you're going out and playing golf. Like, I've got some goddamn bug on my goddamn arm. Pardon my language, but I've don't laugh. I've had injuries where I've been like, I don't know if I can go to play in this event or play with these guys or whatever. And I've been prescribed a steroid pack, and I'm telling you what, like you're not saying it, you feel on top of the world. And
it's amazing.
But I will say this: there is the biggest drawback is you feel amazing, and you could do more damage because you don't feel that pain that you felt, and you're like
perfect. That's exactly it, right? So I talk about in the book. There's this old Bayer commercial. I remember this when I was a kid, like 15 years old. There's this woman playing tennis, and she's a little older, and she goes, when I hit the ball, the pain hits me, and she grabs her elbow, right? And now she like just hammers down some Bayer. And then she turns, the camera flips, like time changed, and now she's hitting the ball, and she turns back to the camera, and she goes, now I don't feel a thing. And you're like, yeah, like that's cool, but the problem's still there. You didn't fix the problem.
I'm just masking
You're just masking it. And that's what we've turned into as a medical society. Every treatment you get right now manages your symptoms. It just masks it, numbs you to them, or just treats the symptoms, not the cause. And it's dangerous because, like what you said, you're going to go play, you're going to do great, you're going to feel good, you're going to want to take more prednisone, more steroids, right? But within weeks, months, years of playing through that, now it's a bigger problem.
And I'll be the first to tell you, I tried to go back-to-back dose packs because I was playing so well on the first pack. And I'm like, I got to keep this rolling. Let's do it. And I got to give a big shout out to the person that said no to me and said, you're going to hurt yourself even more. You don't know that you're hurt right now, and that going back-to-back is going to do more damage than you think if you think you can go out and play 2 weeks and think you're playing well.
And you'd be surprised how rare that is, too. So, like what you said, that's good care right there,
So would you ever recommend it for somebody to help get them like kind of back on track?
Yeah, but you need it. So, yeah. So, and especially if you're an athlete, right? Like if you're an athlete, you got to go fucking play, right? There is no option. But you can't rely on that. That has to be the Band-Aid, but then there has to be something that keeps you there, right?
Okay.
So, yeah, the medication helps, and I love drugs. Like, drugs are great, But drugs don't fix you. They just temporarily help. So now you need to do something that is going to fix you, is going to keep you there, is going to keep you from needing those drugs again. And that's what we do really bad as a society. We are shit at that.
Well, I think
we're all about giving out medications. I mean, you go to any doctor today, you can find any medication you can possibly run into. And, if it weren't for people like you that says, hey, let's look at a different picture here. Let's look at the broader picture here. What's causing this pain? They're in it just to get you in and out.
It's easy, right? It's easy.
And you're in it to help people, to save people. And, I, for one, can tell you that's something I can respect.
No, I appreciate it.
You're exactly right. It is saving people, versus like how many doctors do you know out there that'll just be like, well, take this drug. Okay, once that wears off, take this drug. And I'm convinced that they get kickbacks. I'm absolutely convinced.
Yeah, they do.
Right, that they're just making money off it, and we're just the little test subjects, and just keep giving the medication out, and we're going to keep making the money.
Yeah.
Versus, I actually just changed my doctor because he's like, no, I'm not giving you drugs. Do you have anxiety problems? Go to the therapist and deal with it. Like,
yeah,
don't drink alcohol to deal with it. Don't take Xanax to deal with it.
Right, work out a little bit more, go to sleep a little early, right?
Like figure out your
try
life.
some normal
wrong.
stuff, before you just take a pill. Right.
Exactly, which I wish, like you're saying, I mean, hats off to you, and I wish more people, took it that way. And, obviously I saw it when I went to you. I've actually gone to you multiple times. When I fell down the stairs,
yeah,
that's who I went to go see.
Well, I've been told I have a curved spine, and I think 95% of probably Americans or people have a curved spine. And, I try to, well, I'd be lying. I'm lying. I don't work on my posture. I sit at my desk the way I want to sit. I sit the way I want to sit here. I don't put my arm up next to yours because I look fat. But there are reasons people, have the symptoms that they're in. It's the way that they feel, the way that they feel comfortable. And, to me, I think I'd, would have less back problems if I had better posture and a better core. Speaking of core, not to throw core 3 out there. Or is it core 4?
Core 3.
All right, good.
It should be core 4. I mean, at this point, as you keep
expanding.
expanding.
Yeah,
you keep changing the name.
Yeah, core 8,
right?
core 9,
core 23.
Core 10, core 11.
What is core 3?
Oh, man, I wish I had a good story. If you ask my wife, who's she's a pelvic floor therapist, so we started it together. She'll go into some lie where it's like mind, body, spirit, and the real answer is we were like core physical therapy, and then somebody in Pittsburgh had that, and we're like, all right, well, there's 3 of us, so core 3 physical therapy,
So, and I don't mean to touch on this, but you said it, and I have to ask because my mind is going bonkers right now. She's a
pelvic floor physical therapist. The shit that I know now that I never would have known. Yeah, it'd surprise you.
Well, I mean, just thinking about that, just as like the bells are going off in my head. Give our audience what exactly a pelvic floor therapist is.
So it's male and women, male and female, right?
It's okay. We can edit it out, but we won't.
Yeah, you won't.
We won't.
Won't.
But go ahead.
But male and female, and so for a lot of things, like for males, like post prostatectomy, right? So they have some like prostate pain, or actually like urinary incontinence, or actually even erectile dysfunction. We can get into that one. You seem interested in that.
Don't
one.
point at me. At that. Just because he's got 8 kids doesn't mean I've got a problem with 0 kids. Come on.
For women, a lot of postpartum issues. So pain
Okay.
after birth, bladder pain, again, urinary incontinence, pelvic prolapse. There's rectal prolapse, and then there's this whole bunch of other stuff like vaginismus and
Wow.
The word prolapse to me, I mentioned around my wife, she just goes bonkers. But you know, I'm thinking about it, and I'm like pelvic thrust. That's all I'm thinking of is just pelvic thrust, and I know it's not that.
Does it mean just pelvic region? Is that?
yeah, the pelvic area, right? Yeah. So she, like a urologist, gynecologist, but for physical therapy.
Nice.
I got in the wrong profession.
You're a golf pro, Drew. You're in the right profession. Don't worry. All right, so we've really kind of jumped ahead way on our list
And
here.
that's how we do it. It's
Perfect.
raw.
Yeah.
This is
Yeah,
how we do it.
That's what I like.
This is a conversation. Let's just go backwards a little bit here. So,
So to the rectal stuff.
yes, exactly. You're going right back to that. All right, so when did you decide you wanted to become a physical therapist? And, like, did you have any influences? What's the background story of how you became Dr. Caleb Slater?
I wish I had a better story for you there too. My roommate in college was a physical therapy major, and I played sports my entire life. I pitched into college, had injuries throughout my lifetime, and I've always been interested in physical medicine and sports. So it was ultimately a good fit. But in my 18-year-old brain, I was pre-med, and then I was making a decision. I'm looking around, and all the mothers and fathers that are doctors, they have, a shitty marriage and their kids never see them. And, I try to make like a decision. I'm like, all right, maybe I don't want that. And I want to stay in the medical field, but I want something a little bit less encompassing, right? A little bit less, time consuming. Because we're doctors, like that's who they are, that's their life. And you kind of have to be, right?
Yeah.
So I picked physical therapy, but then I get my doctorate after my master's, and then I get 4 advanced certifications, and I start my own business. So I ended up putting in more hours than I probably would have put in if I had just been a physician. So it was, I don't know, maybe a bad decision.
Being an entrepreneur is tough. It's
It's
a lot of
yeah,
hours.
Yeah. What do you think? So you have 3 kids, right?
I have 3.
What's more, an entrepreneur or having kids? Like I go back and forth.
Oh, I think it depends on how many businesses you have.
Okay. Yeah.
That's what I think. Like, and when I say that, I don't mean like locations. Like you obviously have 4 locations, but I know you have other businesses as well, other
Right.
than just this. Same with me, where we have 4 locations with one of our businesses, but then we have other businesses on top of that.
Yeah.
So I think that really is like it's how many LLCs do you have
It
versus
gets
how many kids you have.
But it's close, right? Like
It's close. It's a toss up.
being a parent's easily one of the hardest things I've ever done. But then being an entrepreneur, being a small business.
And I can come from this spectrum and say, I have 0 kids. Shout out to my wife. And I think that being someone that's an entrepreneur has got to have it a little bit easier. Doesn't matter how many businesses or LLCs or what they have to make sure that their family is taken care of. They got to spend time with their family. They have to make sure that they aren't, and I'm not accusing anybody of being an absent parent. So from that side of it, I would say for me, it would be a whole lot easier because you're dealing with one person versus a family of 4.
So and I only have 2, but getting ready to come here tonight, right? I'm ready to get dressed, and my 8-year-old walks in and she goes, "Daddy, you want to play with me?" And I'm like, "Oh, I'd really like to, but I have to get going." And she goes, "You're getting so." She literally tonight, she goes, "You're getting so busy. You're not having as much time to play with us anymore." And I'm like, "Oh my fucking God!" Like,
Yep.
And that's the balance I'm
kills
talking
you.
about, is being able to balance both sides of that.
But at the same time, though, Drew, like, so at least with my kids, they're very involved with my business. I know your kids are involved as well. And my kids are very involved. I mean, it's an ice cream shop. Like, how can they not be involved? Right? So, but still, like, they're learning how to become an entrepreneur. They're learning how to run a business, right? They see the pain that we go through when we have pain. They see the highs, they see the lows, right? And they're understanding. Like, my son literally came up to me and he goes, "Daddy, I want you to teach me things when I get older."
Love that.
Like, because he sees like what's happening. You know, like I never said that to my dad. It was just more of like, okay, what's happening today? You know, so like and I was also a very stubborn, immature child too. My son is completely different. He's the complete opposite of me, but like that really hit home with me, and I'm like, wow, like you really are paying attention to what we're doing, and you're watching this, and you're seeing that, you know, there's hard work that's going into it. So for me, like all of that, like even if I am missing some things from doing that, I'm still there, and he's still there with me, and my daughters as well. So like, and we're doing it as a family, you know, and there's no better feeling in the world. And you know, please touch on it if you have more to comment. But
I think in the real world, you're an anonymous. I can't even say the word. You're somebody that's not normal. Your business is growing up with your family, where a lot of businesses are growing up outside of the family, where they rarely see mom and dad. Or, you know, you're fortunate, and I give you kudos for that, because you and your wife are doing things to include your kids and show them the hard work, whereas a lot of big businesses that are built, the kids aren't involved. And I'm not saying it's good or bad. I'm just saying that's reality.
But at the end of the day, and Caleb, I know you may agree with this, I'm not going to teach my kids how to do it. I'm going to let somebody else do it.
So in my book, I say a bunch of times, don't treat family or friends, because they won't listen to you, right? So now I've gotten to the point where if a family or a family member or friend comes to me for treatment, I'll give them a little of advice, and then I'll let them see somebody else. And same thing with the kids. Like, so my oldest was having a little bit of low back pain. I took her to go see Rosie at my work. I'm like, all right, I'm not going to tell you anything, because she argues with everything I say. So I was like, all right, I'm going to go. I'm going to have somebody else tell you the same thing I'd tell you, but you're actually going to listen to it.
Yeah, exactly.
And there's nothing wrong with that at all. That actually, I think I respect that more than just sitting back and watching it happen.
Oh, yeah.
I think the result is,
yeah, you
totally
let your kids learn from watching what you do. And obviously, you're going to have their back, right? We're going to have their back, but you let them learn the hard way. You don't baby them,
right?
And you don't just say, "Here you go. We built this. Now go ahead and take it over."
Right.
It's okay. Prove to me that you can do it, and prove to me that you're going to do a good job of it.
Right.
You know, like, because I would love my kids to take over all the stuff that Star and I have going on. Absolutely.
I'm sure
you know, when they graduate high school, here you go. We actually bought 2 properties actually 3. We have 3 properties for our kids, and when they get older, we're going to give them to them, and we're going to say, "Look,
where are these properties located?"
I'm not going to tell you.
Well, what if I wanted to rent one until they're old enough to be there?
You can't. You can't beat the tenants that we have in there.
Okay. All right. So let's get back to our guest here. Let's not talk about where I should live. So the Spinal Truth. Tell us a little bit about it.
So again, kind of a spine-centric approach, and it's because it's the best thing that I found. And I've been a physical therapist for 16 years. I have 4 advanced orthopedic certifications. I've tried everything you can think of, every different type of approach, and I've looked into other treatments that are similar to like what chiropractors do, and massage therapists and acupuncturists and all that stuff that's kind of in the same realm, and it just kept being better and better results the more I would focus on the spine. So I got a certification in like a spine treatment process through McKenzie Physical Therapy. And I started building off of that. And as soon as we like really kind of doubled down, I say in the first chapter, like we kind of changed our lens. We kind of changed the way we look at the body, and we explain your symptoms. And we basically just look to the spine first and see if that changes the problem that you were having. And since we did that, our treatments have gotten simpler, better, longer lasting. And again, now we've been able to treat stuff that's just like that you wouldn't have thought. Like you wouldn't go to physical therapy for acid reflux, right? Like you wouldn't think about it. But that's the treatments that that's the success we've had. Brain fog is another one that doesn't get talked about, and it was a big like post-COVID thing. And so we've had people that have come in with literally they're having some difficulty concentrating. They're having that brain fog. The one guy in the chapter in there, he had COVID, and since then he was having a bunch of difficulties keeping a conversation. He was a banker, so he was having trouble at work. He was having trouble. He was a hockey player and a hockey coach. He was having trouble just with everything that he was doing. A few visits working on his spine, and it was gone. Crohn's is the big one. Asthma was another one. Asthma was kind of a case where another friend, he was having difficulty breathing, and he was, you should get checked out. He got checked out by his primary. He got sent to a pulmonologist. Still nothing. They did all the tests. Everything came back negative. He's having some difficulty breathing, and he's starting to get like anxious. So he works himself up one night, and his wife takes him to the ER. Again, gets worked up, nothing. And they send him to a cardiologist, but he couldn't get a visit. He couldn't get an appointment for like 3-4 months. So he's bitching about it to me one day.
Jeez.
That's
and
not surprising.
I'm like, look, let me take a look and see if there's anything on your spine. It sounds like acid reflux, and maybe at this time, we weren't treating that. I'm like, I don't think there's anything that we can do, but let me take a look. I worked on his spine, and we do like an assessment. So I press on the individual levels of your spine and on the sides, and it's kind of like my assessment. And an area of his spine that would, if it was problematic, limit his breathing was painful and limited in motion. So I worked on that area a little bit. He sat up. He's like, that's the best I've breathed in a few months. So I'm like, okay. And now I'm I'm kind of like a believe nothing what you hear, half of what you see kind of guy, right? And so maybe he just wanted to breathe better and he talked himself into it. So I send him to one of my physical therapists who like treats quite a bit like I do. And I don't tell her anything other than that she's treating somebody for asthma. And she asks more questions. I'm like, no, I'm not going to tell you anything. So she finds the same exact thing that I found, and she treats him, and he gets better. And within about 5-6 visits, he's better. So he goes on this trip for work to Hawaii, and he's talking about this at work or at his retreat. And one of the wives of his coworkers is sitting there saying, that's exactly my story, but I've had it for 3 years and nothing's helped. But she lives in California.
Wow.
So we're like, all right, well, maybe we'll try. Well, maybe we can advise her and stuff. We evaluate her through telehealth, 6 visits. We did once a week. She's completely better. She's no longer using her inhalers. And now we're like, all right, we have something, right? We have something that's different, unique, and needs to be known. Like the whole point of this book was to get the information out there, that there's another box to check off before you go down the rabbit hole of medications, injections, and eventual surgery, right? Like just give this a try. I'm not saying it's going to work for everybody, although you'd be surprised on how often it works and for how many different conditions.
So you've touched on something that I deal with on a daily basis, which is acid reflux. Water will give me heartburn. I've been on some form of a heartburn medicine for as long as I can remember. I was on one that was not over the counter that was great, and then it ran out of its patent, and next thing you know, I'm now back to just omeprazole.
Yeah, do you remember what that one was? Was it taken off the market?
No, it wasn't taken off. They just ran out of patent. It was a Dexilant.
Okay.
But I've come to find out that it's made me have deficiencies in other areas of iron and magnesium by taking these medicine over periods of time. So, I start taking magnesium, I start taking iron, and I'm like, like I said, I have to take something every single day, sometimes twice a day, depending on what I decide to eat. What kind of treatment do you guys do for specifically heartburn?
So the area of your spine, so it's your lower esophageal sphincter, right? That's the little muscle that is in charge of basically keeping down a lot of the acid.
Yep.
Okay.
The flapper.
The flapper, right? But it's like it's basically like a shut or open, okay? And it's a muscle. And I make a joke in the book, like why all of a sudden you'll go to the doctor and they'll do some evaluation, they'll do an upper endoscopy, and they'll say, well, your lower esophageal sphincter is weak. Like, how did it get weak all of a sudden? Like were you not working it out at the gym? You know, like that just doesn't make sense. It doesn't make sense why all of a sudden this internal muscle was weak. You can make an argument like constant pressure against it stretched it or weakened it or something. But there's another argument to be made that the nerve that goes to this, the signal got diminished because you got a little bit of pressure on the nerve. And if you take that pressure off, the signal gets restored. And now all of a sudden you're not stronger, but that muscle is operating at 100%. Right?
Correctly.
Yeah, correctly. Right. And now all of a sudden and it also, the way our body heals is by blood flow. The best way to promote blood flow is muscle contraction. So if that muscle isn't contracting, muscles love to contract. Muscles don't like to be stretched. That's another thing that we should talk about, because you see all these people doing all these stretches. Muscles typically don't like to be stretched. They actually become weak if they get too stretched. So muscles like to contract, and when they contract, they also promote blood flow and that fluid exchange, and that keeps them healthy. Well, if that nerve signal isn't getting there, they can't do that. They can't recover as well. They're not as strong. And again, the simple approach is just restore the nerve signal, and then maybe that's all you have to do. And that's the approach that we take through basically everything now. And again, if we look at your spine and your spine isn't involved, then great. Well, then we do the normal treatment that you'd get at any other physical therapy place.
Right.
But first and foremost, this is the approach we take, and it is rare that we don't find an issue that is at least attributing to your symptoms from the spine, if not fully causing it.
So how is what you do different than going to a chiropractor?
Very similar. So chiropractors actually have a little bit more of this approach that I'm talking about than physical therapists in general, right? Like they treat a little bit more along this line, but they treat you a little bit more passively, right? So you go to a chiropractor or a massage therapist, they put some hot packs on you, they do a little ultrasound, they rub you down, they
give you some stem.
They give you some stem, they crack your back, and then you're out the door. Well, you feel good, but it's not going to last. So it's kind of like that prednisone pack, right? Like you feel good, but you need to do something to keep you good. So that's really where we take that next step is we can do all that stuff that we just talked about, although we don't do a lot of it. We will like crack your back, but again, if you do that, you just temporarily feel good. You need to do something that keeps you good. You need to find a movement that the patient isn't doing as often. Like, and for a lot of us, we're like this, right? Mm-hmm. So, and that's for the thoracic spine. For the acid reflux, you're like this, and you're putting pressure on the nerves in the back. So we just find a movement that you can do that undoes it. We find a strengthening exercise that you can do that will maintain you there. We help you get there by mobilizing you, and that's it. Like, it's a simple approach, right? Like, it's not complicated.
And what's shocking to me is I've seen so many doctors. I've been scoped up and down and have no issues, but yet I've never heard anybody say, have you thought about going to see somebody that could work on your spine or your back to prevent heartburn?
Because it's not out there. Like I said, this is new. Although the theory, the medical foundation is there, right? So I made sure when I was writing this book, it's only about 200 pages. I have about 150 citations in there of case studies and, in the medical literature of where the nerves innervate or previous people that thought this way and did similar techniques. We just never really put it together. And, around 50 years ago, we really took like a divergent approach, and we just really doubled down on pharmaceuticals, right? Like, and it made sense too, because it was like the quick fix, right? So we really got away from that Western or Eastern medicine.
No,
Western medicine.
I get exactly what you're saying. It's like, but it still exists today. Like it if not has grown bigger, where they'll just throw a pill at you and say, "Let me know how you feel."
Yeah.
And I mean, you can attest to this. You've been hurt. I've been hurt. We've all been hurt, and they want to throw a pill at you, and it's like, how about like giving you a reference to somebody that can work on you instead of masking it?
Well, and like what you said, they've done upper and lower endoscopies. They didn't find anything, but their answer was still take this pill. Well, you didn't find anything. You don't even have a label to put on it, but you're going to treat it.
I mean, they said that since I had heartburn so long, and again, hopefully this rabbit hole hasn't hit pause for everybody, but they said I had heartburn so long that there could be cancerous cells in my esophagus.
It's Barrett's esophagus or like pre-Barrett's esophagus,
Yes,
right? Like
and you know, again, so that kind of scared me a little bit.
Sure.
But I mean, you know, after the results, it's like, oh, well, here, keep taking whatever, and it's like, you know, I've gone to a point where, and he and I had a brief text discussion about it. I went and got an IV a couple weeks ago. It's a new place called Drip Bar. They're doing like basically, they can do a lot of things. They got a B12 shot, and I got a thing called a Power Pack IV. I felt great because it gave me nutrients and the vitamins that I wasn't getting in my body. But I'd be lying if I said I felt great for more than like 2 days.
Right.
Because I've been taking all these pills to help the deficiency, but we all know, well, not all of us know, but most know that a pill doesn't necessarily dissolve completely, you know, in your body. And so I thought, let me go get an IV bag of some just powerful stuff. I felt good. I did feel good. But he and I had the discussion. He's like, well, I'm never putting any of that stuff in my body. But I think there's some kind of, do you, or before I say this, do you see any kind of value in that kind of rehab?
Well, and well, let's just say it's like nutrition and supplements. And yeah, like in what you put into your body, that's the way your body's going to operate, right? And I'm not a holistic person. I'm trying to eat better and I'm trying to get more into that, but like I'm steak and beef jerky every day for the most part, right? Like
Love it.
Drinking and you know, all that stuff, all that fun stuff, right? So I don't swing too far in that direction, but what you put in your body, that's the fuel for your body, you know? And these drugs that we're giving them, they have all these side effects, right? And then you take pills for the side effects, and then you turn into that, like, why did she swallow the fly? You know, well, the spider to get the fly, and you know, that type of chasing. So yeah, like I don't mind supplements and stuff like that. And it's the same thing. Well, why not approach it from a few different directions? So again, like if your liver, kidneys, stomach are operating optimally, you know, that signal's getting there, they can probably handle whatever shit you're going to throw at it, right? But if they're not, let's say they're only operating at 80%, well, now all of a sudden, you know, the Sunkiss that you're drinking and the bourbon that's next to you, you know, like
this is all props here. I'm not drinking that. I'm not drinking this. My drink is in this cup here.
Where did the Sunkiss prop come from, though?
You know what? Everybody as a kid loved Sunkiss.
My favorite drink.
Thank you.
That's
exactly why it's there.
Okay. That's fine.
More viewers, Sunkiss, reach out to us. Sponsor. Looked you right in the camera.
All right, so before we go go down that rabbit hole too far.
Before Drew gets too drunk.
Yeah, Drew's going to keep going with that.
Yep.
Let's focus on some golf here. And how do you see a percentage of your clients golfers with golf injuries?
Yeah, and so the big golf injuries I would say would be the medial or lateral epicondylitis. So like golfer's elbow or tennis elbow, and all that is it on the inside of your elbow, and that's golfer's elbow, and is on the outside of your elbow, and that's tennis elbow. So it's medial epicondylitis, lateral epicondylitis, right? Again, if you came to us for that, the first thing we would do is we'd map out your symptoms. So we're looking at your elbow. I don't want to make it sound like we're ignoring your symptoms. So we'd, you know, how strongly can you grip and what pain do you feel? And how far can your elbow go back and what pain do you feel? And how far can it go out? And any of those type of screens, right? But then once we set those baselines, now we know the outside of your elbow is C5, C6. We know the inside of your elbow is T1, T2. So it's your mid-cervical spine or your lower cervical upper thoracic, right? We look at those areas, we press on them. If they're stiff or painful, we say, okay, we mobilize them a little bit. We show you how to do it. And then we go back to those same tests and we see if they've changed. And you'd be so surprised on how many times somebody comes in, they grip something 80 pounds and it's like a 6 out of 10 pain, you know, right here. We work on their neck, 110 pounds, no pain. And you're not stronger. Like you didn't work out right for 6 months. You're not stronger, but the signal was getting there. And now all of a sudden your muscles contracted the right way, the quicker, stronger, but you're not physically stronger because you didn't have weakness. You had a nerve issue.
Do you guys deal with any wrist?
Same thing, like carpal tunnel, you know, and the golfers get a lot of that, like the pinky side, right?
I mean, I went out today and I hit a root, and don't laugh. Just because I wasn't in the fucking middle of the fairway like you are all the time, I hit a root. And I will. This goes back like 5 or 6 years when I was playing Doral, and I hit a root down there, and my club stopped, but my hands kept going forward in the swing.
Yeah.
And immediately, I mean, pain shooting down up this area right here. And every once in a while, I'll hit a certain shot badly or poorly or good or whatever, and I'll feel that pain. I felt it today, and it's like it's not there, but it's there.
Would you ever feel it when you're not shooting? Do you ever feel it when you're just sitting around at rest? You ever feel it when you're like driving in the car?
It's really more just wrist action.
Just wrist stuff?
Mm-hmm.
Okay. Is it ever numbness, tingling, anything like that?
Oh, numbness and basically tingling all the way out to the end of my pinky.
So numbness and tingling. I wrote it in almost every chapter of my book because these are like 5 things that everybody needs to know. There's basically 5 symptoms that if you have them, you're almost guaranteed that there's at least something from your spine or it is the spine. It's a nerve issue, right? And one of them is numbness and tingling. Almost nothing can cause numbness and tingling in your body other than a nerve issue. It could be a blood flow issue, but now you're talking like medical emergency, right? So that's rare, right? Like, so it has to be a nerve issue. And nobody knows this. I'm treating a person right now who she was having numbness and tingling going down both her legs, and the doctor is telling her that she's going to have a total knee. And you're like, no, that's a nerve issue. And right away, one visit, she's 30% better. And you're like, yeah, this is the way medicine should be. It's not complicated. Another one is if it's bilateral, right? So if you have it on both sides, same spot, like if it's here and here,
right,
it's a neck issue. It's a spine issue. It's a nerve issue.
Okay.
Another one is if it's at rest. If you're just sleeping, if you're sitting at your desk, if you're driving and you're getting pain in your knee, pain in your feet, your plantar fasciitis is acting up when you're just sitting there and you're not using your weight-bearing joints, and those weight-bearing joints are hurting, it's a nerve issue.
I have nerve issues.
Well, I think we all have nerve issues. They're mentally and physically.
I gotta go see him. How do I get on like a retainer with you?
Let me ask you.
What do I do?
Let me ask you this. But we were talking before the cameras were rolling. So you've done some work with some professional sports. Talk about that a little bit with us.
So I did an internship a long time ago with the San Francisco Giants, which was really cool. And, we're in the Philly area. So Aaron Rowan was there. You asked about Barry Bonds. He was the year before me. He left the year before me. So I didn't get to see him. So and I think I left the year before they won the World Series. So,
wow.
I mean, you know how I treated you and that was the best year? So it's kind of, I worked there and then, they won the World Series. So I'll take that.
There you go.
Magic.
Yeah,
Magic,
I was a
exactly.
lowly intern at the time. But I got to see how that side of the coin gets treated. And you would think that they're getting this like phenomenal otherworldly treatment, right? Like they're getting the special stuff, and it's not the case. They're just getting quicker medications, quicker injections, quicker MRIs and CT scans and X-rays and stuff like that. But they're getting the same stuff that everybody else is getting. They're just getting it more often. They're getting it twice a day.
They have access to it.
You know that hot pack, ultrasound, massage, e-stim, they're getting that twice a day. So the players come in, they have basically 3 hours of treatment in the morning, and then these are the injured players, and then they have 3 hours of treatment in the afternoon, but it's the same stuff. It's the same stuff, it's just more of it. And I'm trying to tell people, I'm on TikTok now, promote my book, and I'm trying to troll Todd Gurley because the dude was the man, right? Like, I loved watching him play. 5 years of just terrific. He was the best running back, probably the best NFL player for 5 years. And then he just falls off the map, and they're telling him it's arthritis, and it's both knees, and he's running slower. And I can guarantee you it was a back injury. It was a back issue. And if he just turns that signal back on, Todd Gurley's 28 right now, I think. Where's the camera? Can I look at Todd Gurley? Can we?
Yeah, right there.
Can we get
the third camera?
Todd Gurley, man, I will fucking come to you, man. I will fix you. And we'll get you back. Oh man! But so I have an athlete right now, and she's a retired basketball player, and she's in the Hall of Fame for college. She went to a big school. I forget which one it was.
Tennessee.
No, it was a bigger school than that. A better one. Yeah.
That's a bummer.
Ooh, better one.
It's okay. It's okay.
But she
Don't get him on here with Robert.
she's having
Must be
all
Alabama
these knee
fan.
pain problems, right? And she's having bilateral knee pain, driving to work, with numbness and tingling running down her legs. It has to be a nerve issue, right? She's going to these Temple doctors, and then one of the other local team doctors. But again, these vaulted doctors, right? The doctors that they're the best. And they're telling her they're going to have to do a total knee soon. And she's in her mid 40s, right? And that's real early for a total knee. And I'm first visit, I told her no. First visit, I told her, you're going to feel better today. And she's looking at me, that like incredulous look, but I'm basically like Babe Ruth calling my shot. I'm like, today you're going to feel better. And immediately, we established her symptoms, how far could she squat, how much pain was it, stuff like that, how far could she bend her knee or straighten it. And then I worked on her back. In the area of her back, L2, L3, L4, that was the most painful, most limited, and that area goes to your quad and your knee. I had her do some exercises, and all of a sudden she was squatting, I think it was 118. I just treated her, so 118, and then she went to 142.
That's a big jump.
Was a 6 out of 10 pain, and then it was a 2 out of 10 pain, something like that. It was
That's a big jump.
That's like a 25% increase.
Yeah. And she comes back. I've only treated her 2 visits so far, but she comes back, and the next visit she's like, I'm 30% better. And I'm like, yeah, but she still had arthritis, right? Like, and here's something that we want to talk about too, because like she did have arthritis, but her symptoms weren't from her arthritis, and that's the problem that the healthcare system does right now. When they do an image, they act like whatever they see on the image is the cause. But there's a whole bunch of studies out there that say that my favorite study, they did a study where they took a bunch of people off the street, healthy, no symptoms whatsoever, in different decades of their life, 20s, 30s, 40s, 50s, so on. And they did imaging of their spine or joints, and they found that in your 20s, you're like 30% likely to show degenerative changes. So for your knee, degenerative joint disease, meniscus fraying or tearing, stuff like that, right? By the time you hit 50, you're 80 to 90% likely to have these. But remember, like these patients, these people didn't have any symptoms whatsoever. So what it shows us is just like we show signs of aging on the outside, we show those same signs on the inside, but they don't correlate with symptoms. And we know this. It's established in the medical world. But when you go to the doctor and you say my knee hurts, and they do an X-ray and MRI, and it comes up arthritis, they say, there you go. And now I need to do meniscus surgery. Now you need to take a pill. Here's an injection.
This will get you down the road and make you feeling better.
Yeah, it'll basically get you down the road to eventual surgery.
Yep.
Eventually you're going to need surgery because the problem never went away. And you restore that signal, the quad's operating well, blood flow is getting to the joint, which helps it heal. And now all of a sudden, again, like, she has arthritis in her knee. That's not going to change, but all of her symptoms will. And if you have arthritis in your knee, but you have no symptoms whatsoever, do you care?
No.
You don't know it.
You don't know it, right? If you have no recourse from something, you don't necessarily care. And again, it's normal. Like my hair is getting white, and that's because I'm older. I'm starting to see.
That's because you're a dad.
It is.
No, it's not because you're dead. Look at this.
He's salt and pepper. Yeah, but he's a little older than we are.
I'm going for the Clooney look.
Yeah, Drew's 40,
To all
45,
my
right?
lovers out there, I'm going for the Clooney look.
He's 45.
I'm 45. Yeah, I'm 45. Why are you rubbing it in over there, you 38-year-old?
I'm 39
Wait, when you turn 40, I'm 39 too.
in March.
Oh man, I'm feeling that 40.
I'm having a bash.
It's
having a bash in
staring
Myrtle
at
Beach.
me.
You guys
so
are feeling 40? Wait, I've got 5 years on you. Like, wait till you get to. I mean, I feel like I have to stretch to get out of the bed.
Well, it's not even just fit. It's like mental, right? I'm that 40 is just there. I'm thinking, all right, what am I gonna buy? Like motorcycle or Corvette?
I'm literally
Like,
doing leg lifts in the bed. Like, you can do this. You can roll out instead of. And I will. This is not a lie. The last back problem I had, I was rolling out of bed.
No, they suck.
And it's a terrible feeling. But I didn't do anything about it because I got a steroid pack, and then a week later, I felt fine.
And your body adapts too. So I use an analogy in the book. When you put your shirt on in the morning or watch or whatever, it's there for X amount of time, right? But eventually you forget. And your body is the same way. Either eventually you'll get used to that stimulus, and now you have a new, baseline, or your body adapts by protecting that level. So let's just say it's like L4, L5, right? A normal common joint in your low back that has symptoms. Well, L5, S1, and L3, L4 do more work, and L4, L5 gets, the muscle spasm around it. You don't use it, and you don't even realize it. And all of a sudden, now you're doing everything you need to do. You're playing golf, but you're a different person. You don't even realize it. You're using one less joint. You don't have that many, right? So now, it's going to keep happening. And what'll happen is you'll get this medication, and eventually you'll get over it. But you didn't get over it; you just got used to it.
Yeah. So what did Michael do when he fell out of the tree that he was trying to take down in the wintertime with ice on the tree? What exactly did he do to his back?
Well, he had probably a burner, a brachial plexus injury.
Oh, that's right, separated shoulder.
Separated. Well, but he fell onto his head, right? He fell on his head with his arm out, and yeah, he separated his shoulder. It was a traumatic injury. But what also happened too, and so this is what happens: like you have a trauma, and when you let's say you have a trauma and you break your shoulder, well, everybody rightfully so focuses on that broken shoulder, but you fell, right? You landed on your neck, you landed on your spine. Like there was more that happened in your body, but one thing happened the most, so we got hyperfixated on it. So a forceful separation of your head and neck, that's a burner or a stinger in football, right? It's a traction injury to your brachial plexus, so the network of nerves that emerges from your cervical area and travels down your arm. That's why immediately, like, you'll see players, they're kind of their arms dangling and stuff, because they're temporarily paralyzed because the nerves don't like to be stretched. So you overstretch them, and now all of a sudden you're numb, tingling, pain, and you can't move your arm.
Yep.
And if that signal doesn't come back, and specifically head and neck separation, it's on the median nerve, so your C5, C6, and that goes to the outside of your shoulder, right? Sorry, I bumped it. And nobody looks at it because you go to everybody and you say, I separated my shoulder, and everybody looks at your shoulder. Nobody also looks at your spine to make sure that the pressure gets taken off that nerve, so now the muscles can recover, the muscles can function normally.
Well, I feel like everyone tries to, like, when you have these injuries, they try to lock you up. And it's like, well, let's put a cast on it, or let's put a boot on, or let's do something to limit mobility, where what I've noticed with you is it's like, no,
remember your ankle?
Yeah, we're going to add mobility.
Yeah.
Like, no, go ahead. We're going to jump on it.
I remember his ankle. The thing was like a softball.
And you were back playing.
Well, what was funny was because I couldn't get in to see you right away for whatever reason, but I was on a boot for a week, and I couldn't walk up the stairs. Like I couldn't get out of bed really. And I finally went to see you, and you're like, dude, you're going to be running in like 2 days. And I'm like, there's no way. The last week I couldn't walk. And I could literally go for a run 2 days later. And it was more about like, okay, we're going to use this. We're going to throw some mobility in here and show me the different ways of moving it. I don't know your terminology, so I'm not going to butcher it. But basically gave me some exercises to do that allowed me to be literally jumping off of my right foot in 2 days.
Ankle sprains are one of the worst managed stuff in our medical system. They lock you up, right? Exactly what you said. They put you on a boot, an air cast, whatever, and they give you crutches, and they put the fear of God into you. They're like, don't move it. And I had a patient recently, like, she's like crying, and because they told her not to move it, and everything's going through her head. Like, what if she moves it? Is it going to break? Like, no, like, chill. Like, a sprain is typically an inversion sprain. So you turn your foot down and in. So you stretch out here, right? And basically the treatment, again, it's so much simpler than we make it. The treatment, if you've overstretched this and now there's maybe like a ball out here, right, just for argument's sake, go the opposite way of the injury.
I would have loved to have seen his face when he went the opposite way of your injury, because it was a softball, folks. It was not a small, you literally, it looked like you dislocated your ankle.
I mean, I trust Caleb.
Oh,
so
no doubt.
I wasn't going to argue anything that he told me. It was just, okay, I know that this is right. Just go with it and see what happens.
But
literally, I was, this is no exaggeration. I was 60% better walking out the door after a half-hour session.
But mentally,
the first one,
thinking about if my ankle hurts and actually going towards the pain to make it better.
Oh, he just pushed it there.
Well,
he just goes, watch this. And I'm like, okay.
And that's why you don't treat friends and family, because you're like, you skip steps. You don't explain it as well. You're not as nice, right?
But hearing that, I'm like, if something hurts, my immediate mind and tells me you don't go against what hurts you. You let it just heal.
Well, and that's the thing. Like, we're fighting conventional wisdom, right? We're fighting the current medical regime as it stands, and that's the tough part. And like, we're fighting what you've been told by your doctor or by the don't move it, and you're like, no, that's wrong. And the nice thing is that typically I'm able to show you, like what you said, you're 60% better and I can win you over, right? But I gotta do a lot of talking, I gotta convince you, and then I gotta prove it. So I'm behind the eight ball when you come in.
Yeah, I mean, I think yes, for the majority, yes. But knowing your background, knowing what you've done, knowing that I've had prior engagement with an injury with you, like for me, it was pretty simple. It's just like, just help, please. I'm here, like, clean slate, open book. Like, just tell me what I need to do, and we're gonna do it. And I hope most people walk in the door thinking that, because if you're gonna go and you're gonna get treatment, you should be open minded.
Yeah.
And not have
You've
this
been online
predetermined.
recently?
No.
Yeah, I have.
No, I try to ignore.
There's not a ton of open mindedness.
I get it. I try to ignore most of that stuff. I deal with it with golf swings every day. People will walk in, they'll be like, "I know what my problem is. This is what I need to do," and I'm like, "Then why are you here?
No.
Then go fix it." And they're like, "Well, but what I'm doing doesn't work." And I'm like, "Well, then why are you telling me what's supposed to work?" I get it. I mean, it's similar. A lot of things we're talking about tonight, I'm relating to the golf swing and different conversations that we have. With our clients as well. I mean, I think it's people.
Yeah, so you are Titleist certified
Mm-hmm.
in physical therapy.
Mm-hmm.
Tell us a little bit about that and how that works.
And you know what? So I did my TPI certification after pretty much every one of my other certifications. This will give a little bit of credibility to it. So I have my OCS. I'm orthopedic certified. I have my doctorate in this field. I have my certified orthopedic manual. All these certifications, right? I have my fellowship, which is strongly considered like the highest in my field, and then I did my TPI to start getting into some of the golf. I actually found it pretty helpful. I actually liked what they were doing. I liked some of their exercises. I liked their screen. So the cool thing, they have kind of two systems. They use the K-Motion system, where they hook you up with those sensors, and then they evaluate your swing. And the big thing about that is your kinematic sequence. So basically, are you unloading in the correct sequence? Like your hand shouldn't be in front of your shoulders. Your shoulders shouldn't be in front of your waist as you're uncorking. It should be basically bottom up. And they found that the amateur level, they were somewhere around, like, depending on how good they were, 60 to 80% that they had the right kinematic sequence. But at the pro level, 100%. Even if you had some like messed up, like what is it? Furyk has, a weird swing. When he uncorks, it's that right kinematic sequence. So they hook you up to this machine and they basically see what ratio it is. And then they almost put you in like a simulator. It's kind of like the Wii. Remember like the Wii? And they'll have you go through certain exercises and it'll give you like a little ding if you're doing it right. So that was actually really cool. But then for me, being a physical therapist, they have this like 18 to 22 point screen. I forget what it is. And they've mapped out the range of motion that you need for a normal swing. And here's going to go to what you're telling your clients. Most of the time you think about maybe like rotation, right? You think about like waist, shoulder rotation, stuff like that, but you don't really think about neck. But if you picture your swing, like if I'm in my backswing, if I'm a righty and I'm in my backswing, if I'm keeping my head down, my neck is like rotated about 70 degrees to the left. And if you don't have that rotation, so let's say I can't turn my head this way, if I'm going back like this, then I'm going to have to adjust one way or the other. And a lot of times it's by me, I would be looking down or up a little bit more in order to adjust. And a lot of times, so the cool thing was, it was basically like, do you suck or are you physically incapable? Right? Because you go to a golf pro and they're like, all right, a little higher in your backswing. And then no, a little higher in your backswing. All right, now you went higher in your backswing, but this time, don't stand up so much. Well, why are you standing up? Maybe you just suck. But maybe you were compensating because he's telling you higher in your backswing, but you don't have it. You don't have that shoulder mobility. And we screen that, right? So, and that's the nice thing. So if you're a golf pro and you have this guy and you're like, I'm not sure if it's form, if it's mental, or if it's structural. You send them to us, we screen them, and we can tell you like, no, like they have all the range of motion. It's it's just skill. Or no, they didn't have this range of motion. We can work on it and fix that.
And that's one of the things that anybody that teaches golf or any sport, mobility, flexibility, you know, if you are limited to only being able to turn a certain way, there's only so much we can do with the golf swing.
Yeah.
To an
You
extent,
know,
yeah.
to an extent.
To an
You know,
extent.
when we get athletes that play other sports, that you know, I actually my eyes light up when I get an athlete because I know that I can teach them the way that they should hit the golf ball versus somebody that may be 65, 70 years old that doesn't have that mobility anymore, and they're wondering why they're not hitting the ball as well as what they were in the past. So it's something that, again, it all relates because, you know, if you can't turn and turn, you know, you can't hit a golf ball.
When you need to adjust, right? And that adjustment, that makes the skill level has to be up that much higher in order to overcome that adjustment. Like if I don't have my shoulder mobility, so I turn my waist a little bit more and now I'm looking away from the ball, I have to be that much better when I get back, finding the ball, bringing my arms back in that position,
It's so much harder.
It's
and
harder.
You know it is.
Yeah, so when you get somebody that way and you get them on their K vest and you know they have limited mobility, do you try to create more mobility for them, or are you like, look, in golf, this is what your range is, and
No,
you're done?
so you screen them and see if you can, right? So you screen them and you see if there's an exercise or a movement, or if you see if there's like a specifically stuck area of their spine. Like, so again, like shoulder mobility, a lot of times people do shoulder stretches, but the last like 20 to 30 degrees of your shoulder motion overhead is achieved by your thoracic spine. So if you don't have good thoracic mobility, you don't have good shoulder mobility. That's actually what causes impingement most of the time. It's not shoulder problem. It's not a rotator cuff issue. It's that my thoracic spine can't extend properly. So now at the last 20 to 30 degrees, where my thoracic spine is supposed to go back and clear that space in my shoulder joint, it doesn't. So I just jam my shoulder against itself. So we find an exercise that you can do. We mobilize you a little bit, and depending on your age and you know how long it's been going on, like it can be 1-2 visits and you're significantly better, and now you're able to do what your instructor's telling you to do.
Do you partner with any golf pros or any country clubs or anything like that where when you see these people, they come in and they have, you know, the immobility or to be able to move, or they have the mobility and they're complaining about their golf swing, do you send them anywhere to get help?
No, we don't actually do a ton. About 2 years ago, I started treating some of these more like nebulous conditions, and so I wrote a book about that. And in the book, there's your normal shoulder, elbow, wrist, hip, knee, foot, and ankle chapters, but then I talk about the rarer stuff. So I kind of got a little bit more into that realm. I would love to be able to partner with somebody because I would love to work with golfers because they're easier. You know what I mean? They're athletes in general, you know, especially a little on the younger side. You know, we get a lot of chronic pain. We get a lot of people that, you know, Crohn's and stuff like that. They've been like this for years, decades even. They've been on heavy medication, and now it takes a little bit. It takes a little bit to make this change, you know. And normally 4 to 6 weeks, you know, we're making 50% or more improvement. But with your just typical joint issue, you have somebody that comes in with medial wrist pain or medial elbow pain. I mean, a visit or two, and you're making significant difference, and it's a lot easier.
I got about 10 guys I can send your way that request a handicap flag that play at my course that have no business asking for a handicap flag. And I tell them over and over again, if you can't play pickup basketball or pickleball or tennis, golf may not be the sport for you today if you can't walk 15 yards to your ball.
Well, and talking about, you know, before I was coming on here, you were asking me, you know, I asked you, is there certain golf injuries? And you know, you said elbow, wrists, but then it's hips and knees, right? And who do you think of when you hear bilateral hip and knee pain, right? Like who's the golf poster child for that? And it's Tiger Woods, right? You know?
I was thinking of somebody really old, but no, go ahead. That's fine.
And the reason is that golf, you're pretty much in an extended position in your lower back the entire time, right? And when you coil back, you're even more extended. And when you uncoil, you stay in that extended position, and then you come through and you go into an even more extended position. So you need a ton of support here. You need a ton of flexibility into this opposite motion that you never do. And then you go walk, you know, if you're at an elite level, you're walking, which is more extension at your lumbar spine. And that area innervates your hips and your knees. And again, if you have bilateral problems, more often than not, it's a spine issue. So you're talking about like what could you do as a golfer to stay healthy? Like these people that are having trouble walking, it's because basically because their spine is stuck. Picture that like ass out position. They're stuck in that ass out position.
I don't want to picture that. Cause
Wait, so why are the guys that have bigger bellies seem to always like? Well, maybe not nowadays. I'm sorry. Nowadays, you don't really see that so much. But
shout
you know,
out to Drew
up
with a bigger
until
belly.
like 2010, I mean, a lot of the golfer's image was overweight drinkers and smokers. I mean, is what you would see. Like, and they were successful on tour. I mean, look at John Daly.
But they were until a point. They were until some guy came along and was like, "Hey, I'm good and I work out," And then all of a sudden he changed the dynamic. He changed the.
But do you see more people with injuries that work out versus people that don't work out?
Oh, there's both, right? Yeah, there's both. And the cool thing is, and again, I say it a few times, like medicine's simpler than we make it. Whatever you do a bunch, normally all we do is we just figure that out, and then we show you how to do the opposite once in a while to take pressure off that area. That's simple, right? So, CrossFit's another one where they're a lot of that like ass out posture, and all we do, and they have a lot of hip pain, like that hip fullness, hip pain, hip weakness. We just show them how to move the opposite direction. You do a little bit of that before you go to CrossFit. You do a little bit after, and you're good to go. Like, and if you catch it early enough, that's it. That's all you need. But it gets a decade or two down the line, and now all of a sudden, like, it's been going on for longer. There's been more pressure on that nerve for longer. Now it takes a little bit more to take the pressure off, and now there might be a weakness issue. Even when you do restore that signal, that muscle hasn't been functioning, properly for a decade. Now you got to do some strengthening in order to get it back.
So should I reverse my golf position?
No, because
I'm saying like as like to try to help out, like because I have every time I swing a driver, I have back pain. Mid downswing, like right at impact, I feel the pain, and I just say, "Screw it, who cares? Just keep going."
And that's like the athlete mentality, right? And same thing happened to me with pitching, right? And I just thought it was normal that like you couldn't lift your arm after you're done pitching, right? Like, but it's not, and you need to do something about it, or else it's going to get worse, And you're gonna get to the point where you're gonna get locked up, and you're gonna be like, I can't even roll over in bed.
Well, what I've always done is just go to the chiropractor and get on like a month plan with them and go see them every single day for a month.
Yeah.
And that's how I usually fix it.
And again, they help, and I don't want to disparage chiropractors. I'm actually not a big fan of physical therapists in general. My own profession, I'm not too high on. And there's great chiropractors out there, but in general, they make you feel good. But the thing that they're not good at is showing you how to stay good. Like a lot of times you have a chiropractor or somebody that's going to a chiropractor and they've been going for once a week for the last decade. Like, I don't want that. I want to see you for a given period of time, but then I never want to see you again. I never want to see you for ankle again, hopefully, right, if I did my job right.
But see, I feel like total dog shit when I go see my chiropractor, and I'm there for like 3 weeks in a row, and then he's like, all right, so let's schedule the next one. I'm like, all right, I'll be in contact with you, and I never go see him because the pain goes away.
Yeah.
So it's not a disrespect. It's just like, I'm not going to pay you to continually just press on areas that aren't in pain. And I think that's correct me if I'm wrong, is that a normal human in the business kind of attitude?
Very. I do wish we could push back against it a little bit more and do more, work when you are healthy to keep you healthy, and that makes sense. But that's not us as humans, right? Like we'll fix it when it's broke. If it ain't broke, don't fix it.
Drew, I'm related to this guy, and I only call him when I have a problem.
Yeah. Oh, yeah. It's everybody. And you know what it is, too? I can't tell you how many.
But he doesn't take personal because, again, that's a trend. When people start to feel good, they don't continue on to make sure they keep feeling good. They just feel good, and they just say whatever.
My problem is every time I go to see him, he'll be like, all right, we got like 3 more weeks left. And I'm like, I'm done after this week. Don't tell me I have 3 weeks. Tell me I have 10 weeks left.
I'll tell you what. I had a back pain one time where it was shooting down my arm. I mean, lifting it up, just any regular movement. And the chiropractor that I was going to see him, rest in peace, he passed away. He was going in areas that I didn't even think was an area he should be in business in. Like, I'm not saying my crotch because I had arm pain. But he was like digging in certain areas and the relief that came from that, it hurt like hell. But it's like that. I mean, immediately, what you're saying is where's the problem?
Yeah. Look for where it's coming from.
Not the immediate pain, but where is the problem coming from? And I think there's not a lot of people out there that think like that. I haven't met too many people that think like that.
No, and again, there's not, and that's what I'm trying to change, because it can't just be a few. We need to change the medical system on a global scale, because it is fairly simple medicine, and it's, in my mind, it's the correct way, and at the very least, it's just another box. It's just another thing that, after you get your MRI, after you get screened, and there's not like a life-threatening issue, before you do something else that's invasive, and that includes, medication, injection, stuff like that. All right, just have your back properly screened. And if there's an issue, great, give it a try for a few weeks. If it fixes it, good. If not, all right, here's the normal treatment we have now. Great.
I mean, I have one of my best friends. He has had basically his spine fused because he has had so much back pain and the shots weren't working. The doctors basically said, this is how you're going to be the rest of your life, until he found somebody that said, listen, we can do this. And it's basically what they did to Tiger Woods' back. But his insurance waited 2 years to pay for it. They wouldn't accept any kind of recommendations. But ever since, I mean, and we're talking about a guy that can really hit the ball. Ever since he's had the surgery, and he does some rehab, he's been in prime shape. And it sucks that it had to come to that.
Right.
Because he could have done things that maybe prevented that longevity of pain, longevity of whatever, and he could have maybe possibly corrected himself without having to go through that.
Most likely. Yeah. And that, it's a shame. And we get a ton of people that, what are you coming in for? Well, I just had spine surgery. All right. Well, did you ever try therapy? No, never did. And you're like, whoa, like how did you jump? And I mean, it is often. This isn't an exception. This is a norm. And you're like, nobody tried anything beforehand. And you know what? To be fair, what I said about my profession, and I hate to trash it, but I understand why surgeons and doctors don't use this profession as much, because often it is the same lame bullshit stretches that really don't work. And so I get it. I get why they don't trust chiropractors and PTs, and because often they're not good. They're not doing anything that is going to be lasting or a relief. They're just going to go through 6 to 8 weeks of something that they're going to have to pay for. It's not going to work, and then they're going to have to do surgery anyway. So why not jump to the surgery? So I get it, but
Right.
But the problem is that there is something better out there. There is something that actually does work.
Well, he just said it, folks. The Spinal Truth. Dr. Caleb Slater. He has the book here. Does it have any pictures in it?
No pictures.
Ah, man, come on. You got me with some pictures.
You wanted some pictures in the testicular
Yeah, just
chapter,
so I could
right?
actually pay it.
There's a picture.
What is that? Looks like something that could be inside my body right now.
Right?
So this book is all about the what. I was just trying to get the information out there, but I say at the end, like, I understand that I need to write a second book that talks more about the how-to. So this book touches on it a little bit, and I'm trying to do some exercises and stuff like that through my TikTok to try to get a little of the information out there. But I wanted to make this book where this is just an easy read. You can pick it up no matter who you are. There's not a ton of medical jargon in it. And in order to write actually how to do it, I'd have to be a little bit more specific medically, and I would alienate a decent amount of the readers, the non-medical, right? So I just wanted to write, look, there's another way, there's another approach. I wanted to get that out there. It is a simple read. It's not for the medical professional. It's just for the everyday person. But I understand that I need something else that is going to be like, all right, I have knee pain. You're telling me it's my back. What do I do? And so.
Yeah, that was part of my question was, what do I do, right? And I know we can just keep going down rabbit holes with it tonight, but is there anything that you would recommend to people, as far as a stretching or certain positions to get your body into to, help alleviate? Let's just pick on one. Back pain. That's probably the most common, right?
I'm going to interrupt him. Did you hear him when he said earlier the muscles don't like to be stretched?
Well, That's why I'm asking. I'm sure people are wondering.
See, he was listening. Yeah.
I know. And I heard it too, and I'm like, I don't want to ask the question, but I'm going to ask the question and that's why I said, or is there positions that we could get into that could help?
Well, and here's where it gets complicated, right? So you say back pain, but certain parts of your back. You know how you said you have a curvature? Everybody has a curvature in their spine, right? And they're talking more an abnormal curvature, but a chiropractor probably told you that, right? Like, if you've gone to a chiropractor and they haven't told you that you have a curvature or a leg length discrepancy, I would be shocked, right? Like, everybody, your spine is curved. Your spine's supposed to be curved like an S shape because it acts like a coil or a spring to dissipate force, and that forces you walking, coughing, sitting, standing, sneezing. When you're sitting here, when you're lying down, you're putting stress through your spine, and it's either extending or compressing, and that spring coil is what helps help disperse that, right?
Okay.
Different areas of your spine are commonly overloaded in a certain direction, so that other direction would be what you'd want to move. So, for example, your upper back, because of the society, we've been sitting here for an hour. We're gonna drive home. We're gonna go on our phones when we go home. We're gonna wake up tomorrow, be on our computers, drive to work, stuff like that. We're always in this position. So, if you have this part of your area of your spine that's problematic, yeah, it's like extensions backwards in the other direction.
Upper spine.
Yeah, your upper thoracic spine. So talk about your and when you say low back, that's your lumbar spine, right? The upper part of your lumbar spine is where the S goes from one direction to the other, so it's a transitional area. So the upper part of your lumbar spine often needs to flex. So you'd want to bend your knees up, you'd want to flex it that way. The lower part of your lumbar spine, actually you want to go the opposite direction. So like, again, this is where it gets a little complicated because you can say back pain, but it's like what part of your back, what part of your spine. And in general, we have movements that generally work. But you could be the anomaly. You could be a little different, and it takes a little bit of different of a motion. So that's where I kind of hesitated to give directions to somebody that wasn't, immediately in front of me, because it does get a little different.
Is there an 80-20 rule?
Yeah. Yeah, and so 80% of the time, if it's your low back, it needs to extend. So you do like a press up, right? And so if you have plantar fasciitis, if you have pain going down the outside of your leg into your foot, your heel hurts, your toe hurts, that's your L4, L5, S1, it needs to extend most of the time. If you have hip and knee pain, and it's more like the upper part of your back and you're a little locked up and you can't rotate. So for golfers, your TL junction is primarily involved in that rotation. So I bet you guys have a lot of that TL junction problem where rotation's the issue. It needs to flex. So again, if it's your inside of your knee, thigh, outside of your hip, front of your hip, that's your L1, L2, L3 area. It needs to flex.
So if I got liposuction on my belly and got a better core, would that help my back out?
Well, it helps you flex.
I'm serious. There's a lot of options on the table for me right now. There's a lot of options.
No, don't go there.
I'm just asking.
Don't go there.
All right.
Just get on a better diet.
Okay.
You'll be okay.
All right.
Well,
just
you
asking.
know what? And I always tell people too. It's because we get that joke a lot, and we're like, I guarantee somebody that's fatter than you that has less pain. You know what I mean? So I don't like to blame things on weight and age because somebody older and fatter that is healthier, right?
I'm just tired of people walking around like I'm the fucking Pillsbury Doughboy and poking at my belly when they see me. Oh, that wasn't that big when you started working here, and I'm like, seriously? Like, so again, a stronger core is going to help your back.
It does, yeah. Losing weight and getting stronger core helps, but restoring normal motion helps more.
Okay. Take note, folks.
Take note. So, The Spinal Truth by Dr. Caleb Slater. Where can people find you?
Online. Oh, the book or
No, just in general. Online.
In the
like
book.
right now I'm here.
Where can they find you in the book?
But how can people get a hold of you?
So thespinaltruth.com, I have a website, and my office manager or my business manager handles that if anybody writes in. And then we have core3pt.com. It's my business website. Again, you can contact us through that, and we're pretty responsive. We'll get back to you pretty quick.
Anything on social media?
I'm doing TikTok now. I've never had social media my entire life. Now I'm like 6 weeks on TikTok.
Get on the Instagram.
What's the hand? Is there? I don't know TikTok. Is there a handle?
It's called
work?
username, but
Okay.
handle whatever.
What's your username on TikTok?
I think it's the Spinal Truth.
Okay.
That shows you how much
Makes
I
sense.
know about it.
See, if you get a random follower tonight with just a random name, that may be me because I am not on TikTok under my real name. Shout out to me.
Is it me?
No, it's my knee hurts.
My knee hurts.
Everybody says Instagram. Everybody loves Instagram, but
Instagram has you can go viral on TikTok, but you can also on Instagram reach a whole lot bigger spectrum. In my opinion, I think you can. Who knows what the Chinese are doing with TikTok and on our phones and stuff like that. I'm not getting political, trust me, but I just know that Instagram has been around for a long time, and I think you could build even Core 3. Did I get that right?
Yes.
Okay, Core 3. You could even have its own page. You could have your own page. Again, they all sync up to each other. Hashtag it, and next thing you know, you've got a following bigger than you thought of.
we do have, so we actually do have an Instagram. Like we have a Core 3 and a Spinal Truth Instagram. I just never go on them. I only go on TikTok.
You got to go on them.
I gotta go on the
put
gram.
these videos on that for
yeah,
you.
Wait,
absolutely.
hold on. Sean, can you help him, Sean? You got it?
Yeah.
Sean's got it. Sean's got it under control. Sean's really good at this stuff.
We need some young, kid coming in, knowing how to do all the stuff, knowing how to gram and talk and all that crap.
I mean, he taught me a lot of what I do today. I mean, he still does a lot of it, right? I mean, he does the majority of it, but he taught me how to do it to where if I got to do it on the fly, I can do it. And, it's yes, there's a learning curve. Yes, absolutely.
But
It's
there's
not
an
easy.
audience. There's an audience.
There is an audience. I mean, we got some good following through Clubhouse 54. So thank you, everybody. It's been a lot of fun. I mean, just the interactions with everybody. And I don't know how TikTok works, but I don't know if you can interact with them like you can on Instagram. But
unless
it's been fun to
unless
interact.
you're dancing and doing some kind of stupid shit, TikTok honestly is only going to reach the 15 to 24-year-olds.
Well, that's what I was going
What-
to say.
and-
It's demographic. too.
Yeah, and that's where I kind of feel like I'm boring on it. I'm just sitting there talking. I'm like, if you have elbow pain, it might be coming from your neck. And it's like,
Well, you start doing this right here, you may get more audience
Well,
there, but again, rabbit hole. Let's stop doing that.
No, I mean, look, I'll be an actor for you if you want to.
Yeah,
if you want to treat me and we'll videotape the whole thing.
We have to
all
do
for
it in January when you have to climb up a tree to take the decorations down.
you know,
I haven't
honestly-
decorated my house since then.
honestly, let me eval your back. Let me eval you, fix your back
Perfect.
on camera. And then
Dude,
there
that
you
would
go.
be a great
Perfect.
for both of us.
Yeah.
He could look at your back and be like, "Boy,
Well,
awesome."
Well, you
Come
guys,
over to
you
me
guys
and
are
be
actually
like,
set up here. I could bring a pop-up table, do it right here, eval your back. You put it on your thing.
"Do I keep my clothes on?"
I mean, if we want viewers, no.
Oh my goodness!
Oh yeah,
Right.
OnlyFans.
There we go. There's the next social. OnlyFans. I'm sure Drew has one. He has to
I
have
don't.
one.
I mean, I've got great hands and feet, but like, no, I don't.
He
have
did
an
ask.
I got it after hours Clubhouse 54, right?
Ooh,
There-
Clubhouse
it's al-
54
is
after
always-
hours. That's the way we put it. Clubhouse 54,
But-
and then the neon lights after hours.
But it's
The
always
19th
after
hole.
hours. Clubhouse 54 is always after hours.
And then we just need a light that says open and it flashes off every now and then.
Caleb, thank you so much.
Thank you for having me. This was fun.
Yeah, no, absolutely. I know I learn even more, even though every time I go to you, I feel like I'm going to an educational class, which is great because I think that's the best way people learn and understand what's going on. So I appreciate that. Appreciate your approach. And thank you.
You've been listen, you haven't told me anything that, well, you have told me things that I don't understand, but you haven't told me anything that I can't grasp. And that's the big thing. When people are listening or watching this, he's not talking above your head. He's talking to you and telling you this is what the problem is. And I can relate with that. And I respect that because the worst is going to somebody and be like, here's the area of your problem. When in reality, we were talking about it, the area of your problem could be somewhere out here. Yeah. And again, they don't do that. So I appreciate that, Caleb.
Absolutely. The Spinal Truth, Dr. Caleb Slater. Thanks so much. We'll see everybody next time. Thank you.
Peace.